In times of emergency, one must first check the scene, check for any hazards. So far, there is one bystander and one person who is sitting down and is hurt. So since the scene is safe, I approach near to the person and wear my PPE. So I ask the person, "Hey, are you okay?" The person seems to be conscious, seems to be very conscious. However, I've seen that there is a fracture, dislocation on his shoulder, and a moderate bleeding with an embedded object sticking out of her right upper arm. So I'm gonna state my name and ask for consent. So, hey, my name is A1TapusokPracticalExam2. I'm a PT first year student of Velas College and I have some medical training. It appears to be that there's some sort of object embedded in your right upper arm and your shoulder seems to be dislocated. Now I might be able to patch you up. I might put some bandage around that area and I might be able to fix that shoulder of yours with some splint. So I'm gonna need your consent, okay? Okay. So right now I'm gonna be checking for severe bleeding. Since I've checked from head to toe, there is no severe bleeding from my patient. However, there's only a slight moderate bleeding. I saw a bystander. I told him to get close. He might be able to assist me. So, hey, what's your name? Your name is Bob. You're 35 years old, right, Bob? Okay, hi, Bob. So, could you tell me what happened? Oh, there seems to be an accident. How about the pain? What's the pain you're feeling right now? Does it hurt? Could you rate it from 1 to 10? Okay, about 8. So, Bob, do you have any allergies? How about any medication or any medical conditions that should I be concerned about, Bob? So there be none. So Bob, do you feel thirsty? No. So it appears to be that my patient does not seem to be thirsty. She's not in an altered state of consciousness. He's not irritant and he's not having a rapid breathing. Therefore, my person is not in a state of shock. So right now, I'm gonna check you from head to toe, see if there are any underlying issues aside from the ones that I'm seeing right now. So from head down to toe, inhale, exhale. Does it hurt? No. So there's no other cases. So it's now safe for me to do checking. So I call to the bystander, hey, could you call 911 for me? Or call we're in Mactan Island right now, right? Call 032-236-0000. Tell them that there's an emergency right around Mactan Park. There seems to be a person here with an embedded object lying on his upper arm, and there's also severe bleeding, and there's also an embedded object. I'm gonna need assistance as soon as possible. Tell them to call your phone number or call them my phone number 0928-342-8352 and tell them to come as soon as possible. Once help has been made, I could now patch my patient. So don't worry, help is on the way. So first, I'm going to be treating the abrasion. There seems to be an embedded object here on her right upper arm. Could you move? Practical purposes. So first things first, I must not remove the object since it might it might cause complications. So all I need to do is to grab two cloths. I'm going to need your assistance to hold one side and to hold the other. Pinch the embedded object. Pinch the embedded object, but do not remove it. Could you hold both? Now next is to apply bandage. Applying bandage does not mean you need to push the object. Just secure it, make sure that it won't disturb the patient. So I'm gonna reposition myself here. Once again, it's in the lateral portion. It seems to be in the lateral portion, so I need to go around the embedded object but not over it first. So on the upper part of the embedded object, I make a straight line. Excuse me, Bob. While pinching the wound, I carefully not push the embedded object, so go around it Once again, go to the upper portion, lower portion of the wound, the object in the lateral portion. Then once again, side, side. And also take note that during the entire course, I'm not unnecessarily moving the patient since it might worsen the scenario. So I'm just moving her arm, and I'm careful with her shoulder dislocation since I might hurt it, so I must be careful with that. Once it's carefully patched, I applied once the severe bleeding and the embedded object's been patched up, I can now proceed with the right shoulder dislocation. So I grab my splint. Grab the ropes I needed necessarily for the splint and immediately place it over the patient's shoulder. Over the patient's shoulder. Place and shoulder, but not on the lateral arm. The lateral portion, since there lies the wound. So I place again. You hold that, thank you. So apply the splint. Only on the rigid part should I do the square knot. Does it hurt? It does not hurt. So once again, check before I tighten it up, I need to check before adding the splint. So does it feel? Do you feel anything? Okay, good. There's circulation before it, so I can now tighten it up. Good, please add it then. Be sure not to add the splint on top of the patient's dislocation, so that it's been made. I could now move my patient up the transferring. So since your lower extremity has been damaged as well, I'm sure that you can stand. So I'm gonna help you stand. Okay, so 3, 2, 1. You can use your other leg. Okay, stand. Good. Now I'm gonna give you walking assistance all the way to the safer part of the scene. So that's it for my